Well, it's now been about 3 months that the state has been battling COVID-19, and the battle isn't over yet. Hospitals are still rolling with the punches, despite what the number of cases are showing. Fox 55's Caleb Saylor is live to explain what people he spoke with today had to say about the pandemic at this point and how one local hospital is responding to case numbers. Caleb.
Yeah, obviously there's a lot going on in the world right now with protests being at the forefront, but we can't forget about COVID-19 because it's not disappearing anytime soon. And in fact, if you look in our little corner of the state here in Indiana, it appears as if the daily number of cases are starting to climb once again. As with any disease, prevalence rises and falls on a daily and weekly basis, and our region is no different. But if you compare the 3 weeks prior to May 12th, which had our lowest daily count for the month, and the 3 weeks after, trends are showing a slow increase in daily cases heading into June. Dr. Vishal Bhatia with Lutheran Health Network says it's not just about daily cases, but also about doubling time.
Since we've been reopened, we've seen actually the doubling time increase. What doubling time means is the times for the number of cases to double.
An increase in doubling time means we're actually slowing the spread. Bhatia explained the rise in raw case numbers isn't a surprise.
We were expecting that as things reopen and there's loosening of restrictions, in the end, what's going to prevent and flatten the curve is social distancing, hand hygiene, and maintaining that universal masking.
People I spoke with today had mixed reactions on where we are in the pandemic. Mark Schaffner believes the disease still isn't as serious.
I understand the death rate, but if you look at the death rate compared to the population rate, it's less than 1/100th of a percent. Recovery's real good. I've never worn a mask unless I've absolutely had to, like going to a hospital or whatever. So it doesn't scare me a whole lot.
His friend Nuala Wolf is on the other side.
I don't think we've seen the worst of it yet. And that's been my thought all along. I've been an EMT for a long time. And even with the rates being what they are, I don't think we've seen the worst of it yet.
Whether we have or haven't seen the worst of it yet, Dr. Bhatia believes his hospital's plan to deal with an increase in COVID-19 cases while still seeing patients safely will keep everyone safe.
We've been preparing a long time for this. This seems like this has been going forever, and I think we have processes in place to provide safe and appropriate care for our patients.
Bhatia explained to me today that the number of cases at the Lutheran Health Network has not actually increased since May 18th, but he said if they do, their plan is flexible enough to deal with any increases, and they'll still be able to see patients safely. Reporting live in Fort Wayne, Caleb Saylor, Fox 55 News.